Welcome to the next room. Yeah. Welcome to the next room. From the field on my way to the next room. Welcome to the next room.
Welcome back to another episode of Next Roll. Today, have an exciting guest, celebrity dentist, Michael Wright. Michael, great to have you, man. Welcome.
Vernon, thank you for having me, man. Awesome to be here.
Michael, before I begin, I just want to say to everyone listening, do another intro. Welcome back to another episode of Next Roll. Today, I have a very exciting guest. This man is amazing. He's a genius. He's a savior. And he's been very inspirational in my life. Celebrity dentist, Dr. Michael Wright.
Thanks for having me on the show, man. It's an honor. It truly is.
Well, thank you for coming through, Mike. Appreciate you, my man. Hey, Mike, before I begin, I just want to say to everyone listening, follow or subscribe on your favorite platform, please, and thank you. Mike, a lot of people don't know, but there's different terms in when it comes to the world of dentistry. And for you, you're a prosthodontist. What inspired you to become a prosthodontist?
That's a great question, Vernon. First of all, a prosthodontist is one of the 9 specialties recognized by the American Dental Association. To be very specific, we deal with full mouth rehabilitation, reconstruction. We're that last line of defense, if you will, in reconstructing someone's mouth. Going back, Vernon, when I was going through dental school, I had the opportunity of doing an externship with the Tuba City, Arizona for the Navajo Indians. And I made dentures for these people. And the way it worked is they brought the family out. They had to do a lottery system. And only about 50 or so were selected. And then when they came out, they brought the entire family. And I saw firsthand the impact that we had on people and how we can change their quality of life. And after that, I was approached by my director called Driscoll in choosing a career and a specialty of prosthodontics. And it expanded from there. And my love and passion for pros started with making dentures for underprivileged people.
And what are the other names for different people in your industry?
To name a few, everybody remembers braces, right? So braces is orthodontics. People think of root canals. Endodontists do endodontic treatment on your teeth. And then a more common one is oral surgery, those who take out wisdom teeth.
Nice. Very, very nice. And you went to the University of Maryland, right?
Yeah, I actually grew up in the area. I grew up in D.C. as well. I went from St. John's College High School on to UVA, and then I did Maryland Dental School as well as specialty in postdoc at the University of Maryland as well. The world's first dental school, for those who didn't know.
That's pretty. That's amazing. What are some of the things that you've taken from school that you apply to your everyday life?
Wow. From school, everyday life, I would have to say believing in myself, first and foremost. During my time in dental school, the first half of dental school involved like a lot of studying. And then the second half, you got to show off your clinical skills. So I struggled in the very beginning transitioning from the real world. When I left UVA, I took a year to travel and work. I worked at the trademark office in Alexandria, Virginia, Pentagon City area, and Crystal City to be exact. And then when I got to school, it was like school, vacation, if you will, time off, and then transitioning back. So I didn't really know too much about dentistry. I wanted to go into the medical field. So studying was that much harder for me. But when I got into clinic and I started applying these different principles, that's when I was able to really shine.
So what age you said you didn't know anything about dentistry?
No, I did not.
When did you start putting your mind to it? Like, hey, I'm going to do dentistry. When was that?
Wow. Real talk. I had a fraternity brother of mine, Kappa Alpha Psi. He had a cousin that was a dentist that practiced in Miami. And he just talked about this great lifestyle that she lived. And at the time, I thought, man, I'm not sticking my hands in no one's mouths. That's disgusting, right? But as I applied to medical school, I actually got in. I did well on the MCATs, but I even did like banging on the DAT, which I didn't even study for, right? So it was one of those things where I always had a plan B. And given the fact that I did so much better without studying for the DAT versus the MCAT, and then the experience I had in volunteering at the University of Maryland, University of Virginia medical system, I volunteered in oncology ward, and I happened to see a young girl get cancer, and I saw her go through that treatment, and it hurt me. It was a sad experience. I get attached, especially little kids, and I felt depressed. And when interviewed with different dental schools, everyone who came into the school that was in pain, they left without pain. So they're very happy. Those who were embarrassed about their smile and getting new veneers or crowns, you get that instant gratification, and you can see instantly the effect you have on patients each and every day. So that was special. That was dear to my heart. And I thought, well, I can actually be in this field and not have to deal with life and death situations.
I know you see this all the time, but a lot of people come in and a lot of these people don't have confidence in their smiles. To be able to be a man that's about the community, about the people, that's huge, my man. That's huge. Cause I know what it's like to not be confident. Sometimes as people, as human beings, we go through life and everything seems to be intact, right? We have our teeth, we feel beautiful. We feel untouchable. There's a lot of people out there who don't feel that way. Like, how do you encourage someone um, to be more positive and to let them know that it's going to be okay? You know what I mean? You're going to be fine when it comes to just your teeth. Like, how do you, in a sense, I'm trying to say, what's the remedy for that? Like for people who don't have the confidence with their teeth. Insurance, a lot of times insurance don't cover it, right?
Right. Yeah. You're spot on, right? So insurance usually doesn't. And when you're dealing with the area of prosthodontics or especially, we don't take the insurance because a lot of the procedures and technical things that we do aren't even, covered by the reimbursement by the insurance companies. But going back on what you're mentioning about being embarrassed by your smile, man, I had this big snagger tooth growing up. I mean, I look like, you ever watched the Flintstones? I had a saber-tooth tiger, and big teeth hanging out. All the ladies thought I was a little conceited or I was so serious. I was afraid to smile, Vernon. My parents couldn't afford orthodontics, braces, so I had to just tough it out. And then when I got to dental school, I thought, man, if I want to be a dentist, I got to do something about this smile. So I got orthodontics through a student program. And from that point on, man, it really like boosted my confidence. And I was able to smile, walk around with confidence, and that translated to like a mindset in terms of me believing in myself and that I can do that. So it was one of those stepping stones in a positive direction on how I viewed myself. And then I can see, how that relates to my patients. And when they first come in, there's never, by the way, a smile that we hadn't seen. And every patient feels like this is the worst mouth you've ever seen, but it's never. Right. So we're all in that same boat, but I can see the end goal before we start. And I'm usually so excited, my team, about the ability to be able to change these people's lives. It's a great one. And, we get excited about the opportunity of changing someone's quality of life, how they view themselves, and then get very excited about, where they're projected to be in the future and how they can impact others as well.
Yeah. So that age, go back, Michael, for me. You said you started to be more involved in dentistry. What age was that again?
Wow. So how old do we usually graduate from high school? Around 17, 18?
Mm-hmm.
And 4 years of college. And then I did 4 years of dental school. So we're talking 22, 23, and 4 years. It's 27. And then 2, 3 more years of residency. I was like 30, man. I've been in school a long time. So it was basically 10 years outside of high school, right? Is that right? 4, 3, 7,
Okay.
4 years,
No.
7 years. God, am I doing this right? So 4 years of college, 4 years
Uh,
of general school, three. That's 11. 11 years outside of high school.
that's wow. That's wild.
Yeah,
That's
a lot of time.
you. When I look at you, when I think of you, I think of a Renaissance man. And, that's probably. Yeah, I know that sounds like I know you probably heard that so many times, but you've done so many different things. You've gone from dentistry to creating mouth guards to just so on. You just keep going. That's why when I looked at you, I said, "This man right here is unbelievable." Not only is he a genius when it comes to teeth and dentistry overall, but he's good at so many different things. He just keeps going. Like, what do you find the enthusiasm, the energy to just keep pressing forward?
Coming from Mr. Vernon Davis, the entrepreneur, the philanthropist, Super Bowl champ, artist, that means a lot because, I mean, I think we share the same synergy. And I believe it comes from within. Um, as I get excited, I see the ability to help others. I see my overall purpose in life. And that's what keeps me going because I always tell, family members, like every time I get up, I realize there's more to be done. And it's
Mhm.
not like a feeling of being a burden. It's like this excitement, like, wow, I'm still only, touching the surface on what I can do. And, I've been blessed with the ability to meet others like yourself who
Mhm.
share the platform where we have different core expertise, but we share the same core values and wanting to give back and really encourage, inspire, empower others to do even more, especially in the community.
That's all. And talking about community, you've been a man. You're the man. Well, you're the guy who's been rooted into the community. Bethesda, Maryland has recognized you as one of the top prosthodontists.
Yeah, yeah.
Make you feel. What does that feel like?
Well, it's an honor. That's a vote by the community and better yet, by my colleagues, other providers, other dentists in the community. It means a lot. I'm very honored to say that. But with that, is the
Mhm.
bigger ability to actually live up to that and be a voice in the community, reaching back. And, that's one of the things that we developed, which is Dentourage. Dental Tour of the Ages, where we've came together to develop a platform where we're educating doctors on the latest advances in dentistry
Mhm.
while we're empowering not only the current dentists, but future dentists to come. And we're
Mhm.
inspiring through giving back. We've done a number of smile giveaways where we've seen, how lives can be changed down to, just giving back to the community. We haven't touched on this just yet, but each year I give away between 2 and 7,000 mouth guards a year to
Wow.
local camps and kids as a proponent, raising awareness on oral-facial injuries and, making certain that our young athletes are safe.
That's amazing. I talk to my son all the time, Michael, about the importance of wearing his mouth guard because we see these kids with you see them playing, but you don't see their mouthpiece.
Yeah.
Where's your mouthpiece? Like they have to understand that by clenching their teeth on this piece of rubber, it protects your brain. Like,
Hmm.
it protects you. Like, y you know, traumatic brain injury is a big deal, especially later on for these guys who make it to the pro level, is very important. You can touch on that too. Why is that important?
Wow. So, we have to look at concussions is multifaceted thing. So it's just not one thing that you can do to prevent it, but we're looking at ways that we can reduce the incidence of not only concussions, but mouth injuries, trauma to joints, trauma to your jaw, trauma to your teeth. We see a lot of broken teeth. We see a lot of temporal mandibular joint disorders in our practices, which are way surpasses concussions. But these are also long-term injuries that can really affect an individual's ability to speak, eat, and function in their daily lives. So, gosh, I get carried away with this, but I think your original question was, how did we develop this concept? And it was for me just really thinking about a need in the marketplace, a niche
Mhm.
where I can actually design something in the space that I'm working every day. And a lot of mouth guards that are developed are usually people that are non-dental. So I have 2 United States patents in the mouth guard design. And what that does is allows me to implement a lot of the principles of dentistry in the design of the mouth guard itself. So we'll talk about that more later. But yeah, I'm very excited about being able to really help others in the community and enlighten others on the importance of mouth guard protection and oral facial injuries and their teeth and home care, the whole nine.
Yeah, why has it become so normal to not take care of your teeth?
I don't think there's it's a lot of things. One is dental care isn't cheap, right?
Mhm.
Two is I don't think people really take, things like brushing and flossing seriously. And, we're learning more and more each day about the systemic factors that can happen from not having good oral health. The same bacteria that we're finding in the mouth can affect your heart valves and cause dementia, Alzheimer's. There's a lot of studies, and I think it's just getting the message out there that these things can occur, and we're not seeing it, right? So we can always do more to educate our community on oral health.
Mhm. Absolutely. And you placed over 10,000 implants.
Yeah,
Like,
yeah.
when you hear that number, what does that do to you? What does it do?
Well, one, it makes me feel old, but I like to say, I've been practicing for quite a while now. I finished up in '99. So that puts me what over 25 years.
Mhm.
And dental implants, for those who don't know, are, when you're missing a teeth, you have the option of wearing a denture. You have the option of cutting the tooth down in front and behind to replace a tooth. And
Mhm.
then you have this titanium screw that was founded
Mhm.
accidentally by this PI Brandon mark. So this is really fast. It's in the 1950s. This guy, PI Brandon mark, this doctor, figured that titanium can grow, and he was doing it in rabbits. So in 1967, they started doing human studies and found that our bone actually grows to the surface of titanium. So in placing these implants and have been doing it for so long, you get to see what really works. And dentistry is it's not stagnant. It's not dynamic. It's fluid. It's constantly moving with the technology, and
Mhm.
we've seen it really grow in the past 10 years with robotics, with AI, with virtual reality, implant surfaces. So I'm honored to say that I play so many because I've become an expert on what really works, and I can see what that system looks like, or what that crown or material or ceramic, what really works and lasts. And that goes beyond a study of 5 years, 10 years, 15, 20. So I become an expert in the field just based upon that alone.
No, that's awesome. I've been a candidate, Michael, of everything you can think of. From I've had implants, I've had root canals, I've had crowns, veneers. I mean, the whole nine.
Yeah.
So I'm very well vested in this world, and thanks to you for your education. But what happened? What was there before implants?
Well, without implants, you only have the opportunity of wearing a denture or just having a bridge, which means you're cutting the tooth in front and behind and you're cementing a tooth in place.
Mhm.
And we talked about oral health. I mean, it's hard enough flossing without teeth being connected together. So you're, having to take the extra effort to keep it clean, and most people weren't, and that's how you get cavities, or you just took teeth out, right? So I was having a conversation with a patient today about his dad, and at that age, and what dentistry looked like in the 1950s, and technology wasn't there. Most of the times when something broke or hurt, you just removed it. Yeah. After a while, you just have no teeth.
Wow. And kind of to jump forward, Michael, a lot of people may not know this, but after you receive the root canal, you have to go without teeth for like 3 months, right?
No, after you receive the dental implant. So most people don't know that once an implant's placed, you have to allow 4 months for the implant to tape, for the bone to actually go to the surface, and this becomes a part of you. Now, with a lot of the digital dentistry, the surfaces and the techniques we use, you can actually get teeth the same day. And that's my specialty, where I'm doing an all digital workflow. We've done it on a number of patients that we've given smiles away to.
Mhm.
But they don't get their permanents until 4 months later. But we have the ability to 3D print their teeth the same day, which is just amazing, amazing technology.
Yeah, that's crazy, man. That's
Yeah,
crazy to think about that because now, I mean, you don't have to wear dentures, you don't have to go without after you receive that implant, you don't have to like be exposed. Now you can cover it up right away, and that
yeah,
allows you to feel more comfortable, right?
absolutely. Yeah.
Mm.
Maybe next time we can do maybe a podcast on a patient that has this full makeover, and I think that'll be very valuable for our listeners out there, so they can see firsthand, you know, how this patient got there and how
Mhm.
we've been able to transform their lives. And for people who needed a second chance in life, we can hear their story firsthand.
Yeah, we definitely have to share that. I think that'll be great for the listeners as well as uh myself, being educated, love being educated. Tell us the story behind your patented mouth guard.
Woo, how much time we got?
You got time? Right? You can give me the short version.
Short version. Wow. So back in 2009, 2010, 2011, this thing called Concussions just went crazy.
Mhm.
Dr. Bennett Amalo, he discovered CTE. If you think of the movie Concussion, Will Smith played Dr. Amalo.
Mhm.
And it was about, studying the brain. And, with that, we didn't really know the cause. So, you had this rush of helmet companies, padding, you name it. But the most overlooked place was the mouth guard. And what really blew my mind, Vernon, was the fact that mouth guards are mandatory in Pee Wee League, mandatory in high school, mandatory in college, and they're still not mandatory in NFL. That's equivalent of having a seatbelt law on the highway, and then you get to F1 and there's no seatbelt law. That's crazy. And so I had a lot of friends that were played in a league, and they would come in with injuries of the TMJ, temporal mandibular joint. They
Mhm.
couldn't yawn, they couldn't close their mouth properly. And then after treating them, I said, make sure you wear your mouth guard because that's important. Like, Mike, I don't wear one. So that really blew my mind. And then from that point, I made it, my resolve to really make a difference in getting the word out. And I started seeing star players like yourself. Back then, there was Vincent Fuller, D'Angelo Hall. Those were the beginning roots of it. Christopher Harrison, guys that I knew that played in the league, that knew others, and they would come in and I'll treat them. And, the word got out. But the reality of it all is, you guys, you're tough. You care about being injured, but you got to get back in. So it was less about being preventative. It was more about being reactive. So, the draw basically was the design that I'll put on these mouth guards. So I had to make it fun for you guys to actually want it. So I created cool designs like fangs and diamonds, and TMZ did an episode or two on me and these designs for NBA players, for boxers, football players. And then it really took off. It was disheartening to have kids call the office or their parents and they say, hey, I want the mouth guard that Vernon Davis is wearing, or Patrick Willis, or Navarro Bowman. And at first I thought, wow, they're not going to be able to afford what these guys are wearing. I've got to create something that they can afford. So I went out to Dick's Sporting Goods, Sports Authority at the time. I bought, man, like $1,000 worth of mouth guards. And I cut them open, tried them on. The mouth guards that should have fit me didn't fit me. So the sizing was off and the material was either too hard or too soft. Ran up to Maryland and studied the materials. And, I was just out to make a better mousetrap, if you will. And that's what I really dedicated my life to. So that's where the patents came from. I have a unique design
Mhm.
for true fit. And most people don't know this, but I have the world's first magnetic tethering device.
Mhm.
That's patents for where, it prevents reduces the incidence of neck and head injuries by eliminating the tethering straps. You remember how these straps clamp
Mhm.
onto the helmet and then the rest of it's in your mouth. But if you get pulled, it can cause a neck injury. So the magnetic tethering allows a place that you can hold it without being tethered to your face. So safety is all about safety.
And your mouth guard received NSF support, which stands for National Science Foundation. And That's extremely important, Michael, because when I was playing in the NFL, it's probably still that way today. But
Mhm.
in order for us to take certain products, it had to be NSF certified. So that's
Yeah.
major.
Not safe certified. Uh, but that's a great point you brought up, Vernon. I was funded by the National Science Foundation for Smart Guard technology, which we were putting sensors in the mouth guard. I partnered with the University of Maryland, as well as the Fish Health Institute right there in College Park. But to your point, there's really no safety standard established in terms of a mouth guard. And that's something that I'm working currently with without talking too much about proprietary information, but we're creating a new material and trying to create a new standard, if you will, for other companies and others to, really um, create a standard to help protect our athletes.
That's awesome. That's awesome. So when you say protect your athletes, I want to go back just a little bit. Who was give me a list of some of the athletes you had that wore your mouth guards.
Wow. Vernon Davis, you know that guy?
Uh,
Patrick Willis, D'Angelo Hall, Navarro Bowman, AJ Francis, Golden Tate. Oh gosh, I gotta go by teams. Vincent Fuller, Kendall Fuller, Kyle Fuller, Corey Fuller. Let's see, Lorenzo Alexander. Man, there were so many that gosh, who's the other guy from my area? Big guy. Come on, I'm getting old here.
Guy.
You guys are all big. 90, Arizona Cardinals. Oh my God, he's gonna kill me. Donnell Dockett. Yes. Yeah,
Dockett.
yeah.
DMV,
Penny.
one of Maryland's finest.
Yeah, absolutely. Tyrod Taylor,
Okay.
still in the league. Yeah. So utilizing the platform of guys like yourself to really get the message out was really key for me.
No, that's cool. That's cool. And you've gone on
Let's
since.
not forget AP, Adrian Peterson.
That's right. You've gone on from that. So dentistry, mouth guards, and you're continuing to evolve. You created Dentourage, where you go in, you educate and empower clinicians. Tell us a little bit about that.
Wow. So Dentourage was established at an event that actually the concept came about at an event that you invited me to, which was the SFC. So the SFC was the South Florida Championship. That's where we came together and we brought professional anglers, professional athletes, everyone together for a common cause, which was to give back to the community. And Mark had a great concept of bringing people together to catch billfish. And it kind of resonated with me because I thought it was a great idea to bring dentists together for learning while creating a networking environment to meet other celebrities like yourself. And also the ability to give back. What really resonated with me was the SFC gave away $100,000 to local Coast Guard. I thought, wow, all of these things can happen. And then, of course, we launched in August of last year, and we had tremendous support from dental sponsors as well as non-dental sponsors through relationships that you had. But I mean, to have the likeness of Rolls-Royce, Bugatti, Lamborghini supporting us, it was tremendous. And then having the dental community come in and embrace us, and the relationships that were formed from, global companies like Envista, Sprint Ray Technologies, Nobel Biocare. I mean, it was just tremendous. And, those relationships allowed us to be able to give away these smiles with their donations of everyone. So great activity to give back.
Yeah, that's a pretty cool concept you created there, Michael. I just want to remind everyone, if they like this conversation and they love what's going on, all you have to do is click that little follow button on Apple and Spotify. Click that little follow button on Apple and Spotify. Michael, I just want to remind everyone, if they like what Michael, I just want to remind everyone, if they like what they're listening to, all they have to do is click that little follow button on click that little follow button right there on Spotify and Apple. Michael, I just want to remind everyone that they can automatically have these episodes sent to their phone, including the first one all the way up until now. All they have to do is click that little like button. right there. Click that little follow button. I mean, right there. And like, no, hold on. Click that follow button on Apple and Spotify. Okay, one more time. Hey, Michael, real quick, I just want to remind everyone, if they like what they're listening to, follow us. Also, you can automatically have each episode sent directly to your phone. All you have to do is click that little follow button right there on Apple and Spotify. And if you're on YouTube, like and follow us as well. Michael, back to you. If your career were a sports if your career was a sports highlight reel, what would the game-winning moment mean to you? What would it include? What would that game-winning play moment include?
Wow. Highlight reel.
Your
Game.
career highlight reel. What would that game-winning moment? What would be included in that?
Okay. We've hit on all the main points, right? Graduating, coming out of Northwest DC, being selected, handpicked. I was supposed to like being handpicked out of the draft, first round choice. For me, being handpicked to be in a prosthodontic program directly out of dental school was amazing by Dr. Carl Driscoll. That was a tremendous reel there, highlight. With that, I would follow that with, of course, graduating number one in my pros class, followed by TWG, just finding a niche in the market, finding a need, utilizing skills that I learned to really make a difference. And then now, just being able to come full circle with Dentourage and giving back and what these relationships offered, a lot of us. And, in the past year and 9 months, how far we've come, I'm looking at the next year in terms of speaking engagements, more giveaways and other ways we can impact the community. I think it's come all full circle, and I like what the future holds for us.
Mm-hmm. Is there anything else that you have in mind? Something that, I don't know, maybe something that you haven't planned, but it might be somewhere on your list that you haven't talked about? As far as your next role goes?
Well, I'm key opinion leader now for Nobel Biocare implants. They're a large company, global, and I've been handpicked by them to actually represent them with this digital workflow. And I'm getting great enjoyment out of lecturing around the country. Hopefully, I'll make it to the global level. But more importantly than giving that message to other providers, I like the role that I have in trying to really inspire others to look like us to actually get into the field. I don't know if you noticed, but only 3.8% of all dentists are minorities, which is pretty crazy.
That is crazy. Say that one more time, Michael. Say that one more time. Blew my mind. Say that one more time.
3.8% of all dentists. That's what we make up. 3.8%.
Wow. Wow, that's crazy.
And the gap gets even greater when you get into specialty. Less than 1%.
Wow. And why is that?
That's a good question. I think a lot of it is just raising awareness on what dentistry has to offer. And I think, doing more than just going to high school students or college students. I think we need to go into, grade school and help them to realize dentistry has more to offer than just taking out teeth, whitening your teeth, filling your teeth. It's digital surgery. There's a surgical, cosmetic, artistic twist to it where, you can benefit behind and show that part of you that you wouldn't have otherwise with other careers, right? So I think it's just a terrific career opportunity for lots of people.
Well, how do you, so for a lot of people who not educated and who don't want to expound upon that, how do you get them motivated to go in that direction? You know what I mean? Do we need to have more clinics? Do we need to have more systems in schools? What needs to happen?
Well, I think what we need to do is to raise awareness around what dentistry is and what dentistry has to offer, right? So I think, when right now or thinking back of when I volunteered or spoke at different schools, I was going out with a toothbrush and a puppet showing little kids how to brush teeth. Well, now we can show them that, hey, we're using virtual reality. We're using robotics, right?
Mhm.
So they can see that there's a cool factor in exploring this field of dentistry where they can do surgeries and um,
Mhm.
fix teeth and just allowing them to see a different aspect of dentistry that
Mhm.
they'd never seen before. So to answer your question, I think there is more opportunity for persons like myself to volunteer more time at a much younger level to expose our young kids to much more
Hmm. So exposing them early on to
early
get
on.
them captivated, like,
Yeah. And the field is so competitive now, catching them early on where it really inspired them to get better grades because you need to have excellent grades, excellent test scores, and even, to even be a candidate to get into school.
mhm, mhm. No, that's huge. That's huge. Dentistry can be very technical. What's one surprising fact about your work that a lot of people don't know about? Colleagues, patients?
One fact about me,
No, a surprising fact about your work
about my
that a lot
work.
of patients don't know about. I
Wow.
kn I know that that question is a little broad, but what's a surprising
Mm.
fact? 'Cause there's a lot, I'm sure there's a lot that people don't know. I mean, but what's one thing that when people hear it, they're like, "Wow, didn't know that."
I think one point that I can bring up that
Uh-huh.
most people don't know is that, when a cracked tooth or they get an abscess, it can kill them. So I think more people need to take that portion of dentistry very serious because I see patients with broken teeth, different areas of their jaw, and
Mhm.
they're just harboring bacteria. And if all areas of that gets infected, and there's been documented cases, it can kill you. So, oral health has to be taken very, very seriously because it can be detrimental to one's health.
Okay. And you mentioned early on, we talked about the world of prosthodontics, right? Your business, your field, what you're in. A lot of people can't afford it. Insurance don't cover it. So how do people uh, advance their oral health if they don't have the funds? What are some of the things that they can do to compensate for what they can't have?
Well, there's different programs out there. So those who can't afford private practice dentistry, they can go to the dental school, the dental clinics. So you can get discounted care there as well. And then there's always, clinics that are set up specifically for people who can't afford it different times of the year. I know the Redskins or the Commanders, as well as other organizations, will have the back to school uh, events where kids will come in and get book bags and haircuts and dental exams, and there's systems outside that can really help individuals. You just have to really explore them.
Yeah, I guess that's the only way, huh? I mean, I was just thinking about it. I was just trying to get my mind going because you had mentioned like a lot of people can't afford it. So just trying to give them something that they can hold on to when it comes to figuring out their process with their with their dental work. But I guess you summed it all up for us, so I appreciate you. Uh, you mentored a lot of people. What's one piece of advice you can leave with someone who wants to follow you or someone who's having trouble with their next role?
Yeah, Vernon, one of the things I tell kids all the time is, they got to put the work in, and you get nothing through not working hard. One of the expressions we always use is that which you attain too easily, you esteem too lightly.
Mhm.
But, in order to attain anything, you always have to put the work in. You as a football player, former athlete, former great athlete, that you have to put a lot of time working. And we have to do the same. So I always say that also that, don't be complacent. I think complacency builds mediocrity. Don't just get the good enough grades to pass. Be great.
Mhm.
Push the limit 1,000% so that you'll have more opportunities when the time comes. So, just think with yourself, if you just caught the bare minimum amount of balls or your blocking skill just enough to make the team, you wouldn't be the great Vernon Davis. It was always that effort
Mhm.
that you took to go above and beyond that made you an excellent player. And the same thing goes for anyone in life, no matter which career choice they choose. In order to be the best, you have to put the time in. Hey, I'm on.
I'm still on here,
You
Mike. I
looks
don't
like
see you.
you're yeah, it looks like you're
Let
frozen.
me see. All right.
Yeah.
Let me go.
Let's see.
You should pop up on this screen here.
Look what I just said. Look like you're praying.
There you go, Michael. I think I got you.
Okay.
Mike, can you hear me? Yeah, I'm here. I just
Hello?
can't see you.
Huh. What if I should jump out and come back in?
Yeah.
Looks like I'm
you
fine.
should try to close and come back.
Okay.
Okay. All right.
Okay.
There we go, my man. All right.
All right.
We're about to wrap up, Michael. I'm
Yeah,
done
yeah.
with you.
If you want to do any of that stuff over, if any of it got too boring or you want me to answer differently, go back.
See. No, I think it was good. What'd you cut off at? No, I think you were good. You mentored so many people. Michael, what's one piece of advice you would leave with people who want to be like you, or just people who are having trouble finding that next role?
Wow. Be like me. What do you mean be like me, Vernon? You mean in the medical space?
You're a hero. You're um everything that every young person strive to be like. I mean, from everything you've done all the way up until now, and the fact that you've made it so far in your space and you're continuing to press forward is remarkable, man. It's like it's very inspiring to me.
Well, thank you. My advice basically is just never stop grinding. Just keep pushing. All right. So find something that you're very passionate about and just think that you can make a difference. And never stop believing and never stop dreaming. And I think that's one of the biggest things for me is I always dreamed. And I believe in the law of attraction, manifesting, positive thoughts and things will come about. And, the second portion of that is just really putting in the effort. I can't keep saying that enough. Putting in effort, positioning yourself so that you're succeeding, whether that's, on the playground, in school, making certain you're studying and getting good grades. And I think also left out a really important part is just making certain that you're surrounding yourself by positive people, good people. I make sure you have a good core. And that changes your mindset on things. You want to be around other people who are visionaries, other people who want to be innovators, other people, Vernon, if you wanted to be a great football star, you didn't surround yourself by soccer players. You didn't surround yourself by, a bunch of knuckleheads, right? But, you have to separate in order to perfect your craft. And, that's what it was for me. And it took a lot of sacrifice. Nowadays, everyone believes that success is overnight. I mean, we just did the math. 11 years outside of college, wasn't it? No, high school. 11 years out of high school, I had to put my head down and just keep pushing. I think the hardest part was when I came out of dental school and decided to do 3 more hard years. A lot of my classmates were coming out making money. And I was poor. I was starving. I wasn't. I thought to myself, what did I get myself into? But, you have to look at the long term. And now, as the expression is when you specialize, you're putting in half the amount of hours and making twice the money. At least that's what they say. But for me, it wasn't about money. It was about, making a difference, being a person who perfected their craft, and better yet, inspiring others and helping others believe that they too can do it. Because, if you knew my story, it wasn't an easy one. And if I can do it, I believe everyone else can. And, and that started with having a good core of people around me to really push me to become a better person all around.
Michael, I want to say thank you, my man. I know, it's getting a little late. You have things to do, probably get ready for your next role. But thank you for coming, thank you for being fearless. Thank you for being resilient and taking a chance, taking the leap as you continue to move forward to your next role. So thank you.
Well, thank you for having me on, Vernon. It's an honor, privilege, man, sharing your platform once again. And you are a testament to hard work. And I love what you're doing, having others like myself on the podcast in order to provide a pathway for others to learn how they too can achieve. And with that, I say everyone can be great. And it starts today. Thank you very much.
Absolutely. Thank you.
Yeah. All right. Take care.
Welcome to the next row.